Hello.
Hey Jason, how are you?
Good, how are you?
Good to meet you. I've heard a lot about you. What do you do here? What is your position here at the Advanced Sports Medicine Center?
Yes, I'm a physician assistant here with Dr. Moore. And I've been here with him for 6 years now and graduated from the University of Iowa. And then have been working with him since. Absolutely, absolutely. So, and it's been a wonderful place to be. And he's a wonderful surgeon to work with.
We seem to be getting a lot more physicians now are using physician assistants as opposed to the old days when you always went right to see the doctor. I want to see the doctor. What is the reason for that? Is that the trend that we're going to see in the next years to come?
Well, absolutely. I think that medicine is kind of evolving with time, and with that evolution, there are more and more physician assistants in all areas of medicine, especially in orthopedic surgery, where we serve many different roles. And for Dr. Moore here, I see patients in the office, both new patients, follow-ups, patients before and after surgery, and also assist him in surgery. So there's a big role for me to fill here in the office with Dr.
Were you specially trained to be a physician assistant?
Absolutely. As a physician assistant, usually the education is you go your undergraduate degree, and then you go on to graduate school and get a master's degree in physician assistant studies. And then after that, you may or may not, some physician assistants do go on to residencies, but most don't go out into a job, and that's where they become trained.
So you're really trained for this?
Yes, absolutely.
So what do we have? You've got a patient here?
Absolutely. We've been working with Herky here.
Say that again, Herky?
Yes, Herky.
Yes, my sister couldn't say Herbie, it came out Herky.
Sounds good to me, Herky.
So, and he has had some issues with his shoulder, and so he has come to see me, and we've been speaking about his shoulder issues and been doing some exam, and he's going to be having an MRI on his shoulder to further diagnose and find his issues, and then at that point, depending on what that shows, he'll see Dr. Moore, and options for him could be conservative things as well as surgical options for that.
How did you sustain the injury, Herky?
Working. Fell off of Jack.
That'll do it.
Absolutely. We get to see a wide variety of patients, from people that have been injured at work to people who've had sports injuries, and in our community there's athletes of all ages, from young athletes to senior citizens too.
Well, I've really enjoyed this, and I look forward to going around and meeting some of your cohorts and talking later with Dr. Moore.
Absolutely.
Thank you, Jason.
Yeah, my pleasure. Thank you.
We just left Jason. Now we're in with April Colby, am I correct?
You are correct.
And you've been with Dr. Moore for how long?
About 2 years now.
2 years. You're a physician assistant.
I am, yes.
Went through all the school.
I did. I got my Bachelor's of Science, and then I went on to get my Master's degree in Physician Assistant at Nova Southeastern University.
Now, a little bit different road you took than Jason. You were actually working for Dr. Moore prior to graduation and with the accreditation, etc.
Correct, yes. In PA school we do rotations with different fields of work, and I actually did a surgery rotation here with Dr. Moore for about 12 weeks while I was in PA school. And from then on, I knew I wanted to go into orthopedics as a physician assistant. So I love Dr. Moore and the practice, and I wanted to join his team.
So why did you pick Dr. Moore?
Oh, I love Dr. Moore because he's very personable as a person, and he is excellent at what he does. He's one of the best orthopedic physicians around town, and I really like the way he works.
He has a tremendous reputation. I mean, and not just at the lower level, at the scholastic level, the collegiate level, and the professional level.
Yes, he does.
Now, you have a very young patient right here, April. Could we describe, or you describe a little bit of the injury that we're going to look into here today?
Yes, this is a 8-year-old who's been involved in gymnastics for a few years, and she came in with knee pain.
Don't be you got a pretty face. You want everybody to see your face. Look into the camera.
We're suspecting that this knee pain is probably just an overuse injury from just the gymnastics and the sports that she's been involved with, and doing things around the house, probably just overuse with riding her bike and jumping on the trampoline and everything that kids do. So we're going to look into that further.
So you're going to do x-rays?
Yes, x-rays would be the next step. We are going to look at the alignment of her bones in the knee and look at her growth plates, which is basically a common injury that kids get.
So it wouldn't be invasive surgery or anything like that?
No invasive surgery. Normally with growth plate injuries, we do just absorb symptoms and normally they will gradually heal on their own.
What suggestion would you make to the parents as far as making sure that the children don't get too carried away and maybe just try to do things that they're not capable of doing, thus creating maybe a problem, not a bad problem, but is there a limitation? Maybe you should keep it. Moderation, I guess, is the key to everything.
Basically moderation. I would probably suggest that parents just monitor their kids and what they get involved with. Overuse injuries are common in kids that are involved with sports, say on teams and things like that, where they're constantly doing games and practices, and just sometimes patients will overuse their limbs, their knees, their shoulders with throwing, and in her case in gymnastics. So it's really important for the parents just to monitor how much they do get involved with, and if they are having pain, to quickly get an evaluation of what's going on.
Well, thank you. Very, very informational, and I want to thank you, and I wish you best of luck in your competition as the years go by, and I'm sure you're going to be a success.
She will.
Thank you, April.
Thank you. You're welcome.
Hi, I'm Randy Crowder, former NFL nose tackle. Having played for the Bucks and Dolphins, my body took a beating. Because of Dr. Moore's knee replacement, I can walk today. If you have knee, hip, or shoulder problems, don't get sidelined. Take it from a pro. See a pro. See Dr. John Moore.
Playing Major League Baseball for the Cardinals, Phillies, and Red Sox, my body really took a beating. If you have knee, hip, or shoulder problems, don't get stranded on third base. Get your life back. Take it from a pro. See a pro. See Dr. John Moore.
I'm here with Carmen and Bob. Bob, you're going to have an MRI, I've been told.
Yes, I am.
What kind of an MRI?
On the shoulder. Actually, I've had a number of MRIs performed, knees, but this one happens to be a shoulder.
Okay, now Carmen, let me ask you this. What is the preparation for an MRI? Do you have to not eat 24 hours before, not brush your teeth, or is there any?
No.
No, that's stuff.
No, everything is pretty quick and simple. Patient needs to be comfortably dressed, make sure there's no metal on the patient, glasses, hearing aids, anything of that nature, keys, loose change, watch, everything needs to come out of pockets. It's pretty quick and it's pretty easy and it's very painless.
Now, would this be an open MRI or a closed MRI?
This will be an open MRI.
And about how long does it take?
It takes about maybe 20 minutes, 20 to 25 minutes, but it is an open MRI, so it's pretty quick.
So you're gonna treat Bob really good.
Bob's going to get very special care.
Well, you know what, Don? Another thing that's very important, I think that people need to know, is MRIs are virtually painless and quite enjoyable. Matter of fact, it hasn't been unknown that I've taken a nap during an MRI, so it's pretty good.
Okay, Bob. So enjoy your nap tomorrow, and I know Carmen's going to take good care of you.
We'll tuck him in.
Yes, she's the best.
Okay, Carmen. Nice
Thank
talking
you.
to both of you.
Thank you.
We're here with Dr. Conrad Penner, and you're a physical therapist here at the Advanced Sports Medicine Center. Could you describe to our viewers a little bit what physical therapy is all about?
Physical therapy in our office really has a lot to do with restoring normal movement and function for our patients. And so that involves treating athletes, treating different people with orthopedic conditions to restore normal use of their limbs, particularly shoulders, knees.
Just give me an example. Just give me an example.
One example would be is if, for example, you're playing tennis and you hurt your shoulder, and let's say Dr. Moore did an operation on it to restore normal anatomy, then we would go in and do therapy to restore normal.
After the operation?
Yes, after the operation we would do.
So you come in after the operation and kind of just finish the job?
In that instance we would, yes.
Okay, now we've got James in the other room. Now, what would his position be?
He is an athletic trainer who helps me perform sports physical therapy and sports rehab on all of our clients.
Good. Well, let's go meet James.
All right.
We also have Katarina here, who is a cheerleader for the Sarasota
Sun Devils.
Sun Devils. I tell you what, I don't know how good a team they are, but they have a pretty good selection process as far as cheerleaders. James, what are you doing here?
I'm doing ultrasound on Katarina, and what this has helped is to help to improve tissue function and tissue healing. It promotes the tissue healing from her knee injury that she sustained while doing cheerleading.
Now, how many procedures? How long would it take for this to be a finished product?
From start to finish, depending on her injury itself, she's going to be back in a couple of weeks.
But this won't be a continuing injury, it's going to be a healable injury.
Correct. She'll be, once she's healed, she'll be fine. You won't have an issue, and she won't have anything to worry about from reoccurring from that standpoint. No.
Well, once she leaves the facility here, what are the things that she shouldn't do while she's rehabilitating?
The main thing that we use is pain. You know, pain's going to be her guide from whatever she's going to be doing, even during therapy. Pain is our guide to, if the body signals pain, that's what alerts the body to stop. So when you work through pain and the old adage of no pain, no gain, that doesn't apply here.
Don't fight it.
Don't fight it. Exactly. It's telling you to stop.
Okay, good luck, Katerina. Dr. Moore, we're here with one of your younger patients. I'm talking about 93-year-old Kay, and whatever you did it right, Kay. You look like $1 million.
Thank you.
Now, Kay is here to see you. What do we want to talk about as far as Kay's situation?
So Kay is here today to consider a DEXA scan, the machine that she is sitting in front of. A DEXA scan is also called a bone density test. The bone density test has to do with ruling out the risk for fractures. In other words, it measures the amount of mineral, the hardness in the bones, so that we can tell in your lifetime how much risk of a fracture you might have. Medicare has indicated guidelines for DEXA scan and bone density scanning, such that once you're Medicare age, you should have a bone density scan every 2 years. In other words, just like a mammogram, you should have a study done every so often to rule out breast cancer, or a pap smear to rule out uterine cancer. Bone density scan is to rule out your risk for a fracture, so we can intervene so that throughout your whole lifetime you never have a fracture. Once you've had a fracture, the risk goes up, so we ask that you have a bone density scan or a DEXA scan every single year. It has to do with measuring the amount of X radiation that goes through bones, and it measures it by computer and gives you a readout of where you stand, and then after treatment it measures the effectiveness of your treatment to prevent osteoporosis and risk for fractures as well.
Now, if it comes out positive, what kind of treatment are you talking about, Dr. Moore?
Oftentimes it requires an endocrinology evaluation. Initially, what we do is start people on a resistive strengthening program, which we can design with the help of a physical therapist. Everybody can't do the same sort of strengthening program. Some people might have worn out knees, so they can't do running, or they might have worn out shoulders, so they can't do overhead weightlifting. But we can design programs where we can stress your muscles in your bones so that creates strength in your bones. And then we ask people to take an adequate amount of calcium and vitamin D, which are the basic proponents of hardness in bones. And sometimes it even requires a hormonal evaluation, because once people get to menopause age, the amount of estrogen in your body diminishes, which increases the risk of depleting the mineral in the bone, makes them softer, more prone to fractures. So we ask that the endocrinologist come in and give one of many different types of medications that actually increase the amount of hardness or the amount of mineral in the bone.
And you know, one of the things about a long life is being active. And so really what you're doing is you're taking patients that, if they didn't come and do what you just described, would probably take say, oh, I'm too old to do that. Where in reality, you can fix it, and they can, no matter what athletic event or whatever they do as far as physical activity, it can't hurt.
My sports medicine practice includes all ages from children to 93-year-olds. So many people play softball into their 80s and 90s, amazingly, golf and tennis and any variety of things from yoga to weightlifting and all those activities. So we want you to stay active without question. But again, everybody's different. So it takes a combination of medical evaluation and physical therapy expertise to design a program that's specific for you to optimize your health while not taking one step forward and 2 steps back by making a new problem through an exercise program that's not applicable to you.
Okay, just as we close, in a couple sentences, any advice to the viewers as far as longevity in life?
I walked a lot, very much, and I went to the YMCA for 13 years. And after that, when my husband died, I went to promised myself that I would walk all the way to downtown, and that's about 8 blocks from my house. And I did that every day until last year.
Good for you.
And I can't do it this year, but I'm walking.
You're a role model.
She obviously keeps up a very healthy lifestyle. She's slender. She has a very positive attitude. She eats well. She exercises. She walks. She's very positive and listens to advice and takes recommendations very well. She does lots of things to keep herself in excellent health, and she's reaping the rewards for it.
I'll tell you what, if I was taking an exam tomorrow with her, I'd cheat off her paper. She's got a sharper mind than I do. Thank you, Doctor.
She does wonderfully. Thank you.
Hi, I'm Randy Crowder, former NFL nose tackle. Having played for the Bucks and Dolphins, my body took a beating. Because of Dr. Moore's knee replacement, I can walk today. If you have knee, hip, or shoulder problems, don't get sidelined. Take it from a pro. See a pro. See Dr. John Moore.
Playing Major League Baseball for the Cardinals, Phillies, and Red Sox, my body really took a beating. If you have knee, hip, or shoulder problems, don't get stranded on third base. Get your life back. Take it from a pro. See a pro. See Dr. John Moore.
Well, Dr. Moore, I want to just say you've got a wonderful staff here. Wonderful staff. We've interviewed them, and the viewers have seen them, and they're very, very conscientious and well-trained, and you should be very proud of them.
Thank you very much. They try very hard. They try to do an excellent job.
Well, it all gets down to the leader. You've done a nice job leading this group. First of all, I want to just say congratulations to your new facility here on the South Trail.
Thank you very much. We had a vision of creating an orthopedic practice in sports medicine where we could accomplish pretty much one-stop shopping for the treatment of what I do, which is sports medicine. So along those lines, we've arranged a situation where we have diagnostics such as X-ray and MRI and DEXA bone density scanning. We can do physical therapy right here in the office so that we can introduce a rehab protocol as well, and we're attached with our surgery center also. So effectively we try to accomplish the entirety of orthopedic sports medicine extremity treatments right here. So really it's one-stop shopping when you really think about it. The person has an injury, be it sports or on a work-related injury, whatever it might be. They don't have to go to one spot, be referred to another spot, referred to another spot. They can come here and you've got the whole caboose. The whole shooting match is right here. So it's efficient for patients, it's friendly for patients, and we actually think that we have a good product because, for example, if one does therapy here, I get to supervise on an almost daily basis, depending on what the patient needs. If there's a problem that crops up or the patient thinks of a question or whatever, it's right here. So we have back and forth. The therapists don't have to wonder what I'm thinking. They have my chart. They can look right in. They know exactly what's happening at all times. If the MRI technician has a question about what kind of view, whatever, they walk right over and we take care of it right there on the spot. So it makes it efficient and easy for the patients.
Let me talk about some of the players. Let me mention the name Dr. Conrad Penner.
Conrad is a PhD in physical therapy, which is a rare entity at this point, and he does a great job, has special expertise in physical therapy of the spine and the extremities. He's been a huge asset since he came along with us. You say unique. Is there only what makes him unique from other physical therapists? Physical therapists can, it's a very rigorous degree to begin with, but you can stop at the Bachelor of Science degree in physical therapy, or you can go on to get a master's degree, and he actually went on to become a doctor of physical therapy. One smart cookie. Very smart and very capable.
Dr. Rosen.
Dr. Roman Rosen is the radiologist associated with our practice, and so although I read my own MRIs, he overreads them, so we check one another to make sure that we don't overlook any type of pathology. He's excellent at what he does. He specializes or limits himself to musculoskeletal MRI radiology. So he's a huge asset as well. We've had the chance to actually travel and lecture internationally. In fact, not so long ago, he was one of the guest lecturers in musculoskeletal orthopedics on my part and radiology on his part in Russia. We were able to go to St. Petersburg and the Novgorod, former capital, to teach Russian orthopedic surgeons about musculoskeletal training as it's done in the United States.
How many years back was that?
Maybe 4 years.
4 years. How was Russia? How was it? Is it an interesting place?
Extremely interesting. The people are fabulous, tremendously friendly, warm, wonderful people. The governments are the problem in our world, but not the people. The Russian people were fabulous, tremendous experience, huge contrast between Americans and the Russians. Here we do 300,000 total joints in the United States per year. There they do 300 total knees per year. So 300,000 for 300, just a quick example of
must
the
have been
difference between the two countries.
Very interesting trip.
Tremendously interesting and tremendously fulfilling.
Let's start with your trip. I mean, in sports, you know, you've specialized in sports medicine, although you do the whole deal. You must have played sports as a youngster.
I did. I had a very athletic family. All of us played sports, and I played football, basketball, and baseball in high school. I was fortunate enough to be given a football scholarship at Kent State University, where I enjoyed it very much, learned a lot of discipline, a lot about the game, had a great experience as well.
Where did you go to school after?
From undergrad, I went to Ohio State University, and then I went to the Medical College of Ohio. From there, I spent 5 years of orthopedic training at Ochsner Medical Foundation, which is in New Orleans. And from there, I went to University of Iowa, where I did a one-year sports medicine arthroscopy fellowship, taking care of the Iowa Hawkeyes. And from there, I did another fellowship in shoulder surgery with Richard Hawkins, currently at the Stedman Hawkins Foundation. That was in London, Ontario, Canada. So I had a little bit of insight into the Canadian healthcare system as well.
How many years of training have you had? I mean, before you finally set up your own practice?
After high school, it was 14 years of college, some of which I got paid minimum wage for. Some of which I didn't get paid at all for.
Well, it took me 14 years. I was only liberal arts.
I understand. It's a tough road.
Okay, let's get into the practice. How would you talk about your? How would you describe your practice here in Sarasota?
My practice pretty much reflects what my training is. So my expertise is in sports medicine, and that shakes out to be mostly knees and shoulders. So whereas I arthroscope shoulders, elbows, wrists, hips, knees, and ankles, the lion's share of what I do is knees and shoulders and hips in that order.
Where do the injuries come from? Is it not just sports? I mean, they come in from all phases of life?
Certainly sports is a huge portion of what I do, but sports can mean different things to different people. So if I were in a monster big city, maybe I could only do university athletes or pro athletes. But in Sarasota, I take care of high school athletes, some professional athletes. I took care of the Cincinnati Reds when they were here for many years. Still have an association with them, although they're, when I take care of them, it's in an Arizona venue instead of here in Sarasota now.
Did you go out to Arizona?
Yes, still part of the Reds, but not on the same basis as I was
before. But you've got to be thrilled with what they're doing this year. I mean, they're running away with the National League Central.
They have more pitching than they know what to do with, and their bats are hot too.
And
very proud of them.
They're nice people. Was it Castellani?
Absolutely.
Yeah.
Mr. Castellani and Tim Kremchak, the main doctor in Cincinnati. Great people, wonderful to work with, and they deserve having a great run right now.
You realize when you're dealing with injuries with professional athletes, these people are paying a lot of money, millions and millions of dollars, and really, in your hands is their career and their financial security. I mean, does that ever enter your mind when you're working on these professional athletes?
That's true. The demand is high, and they expect to have things right away and done well the first time. But as you raise the ante, that's why we're surgeons. Actually, we like stress, we like pressure. If you didn't like it, you wouldn't be a surgeon. So we like to be the person who's standing on the free throw line with 1 second left. With you got to make the free throw to win or lose.
But let's give you a sense of pleasure when you watch and see the Reds on television. You see a batter get up, or you see a pitcher throw that you had fixed and you healed them. I mean, that's got to, make you feel pretty good.
It is neat stuff, and many of the players are tremendous people as well as tremendous athletes. So it's extra fulfilling to actually be able to take care of them and get to know them as well.
You say hips, knees, and shoulders. Have there been any improvements in the treatment of these injuries over the course of your career?
It's constant and ongoing, and one of the especially great things about orthopedics is that it's constantly changing. You can't sit tight. It's not like history where you learn it and it's there forevermore. The bar constantly changes and gets raised, and that's good. We do more and more microscopically with an arthroscope through tiny incisions as opposed to open surgery. Joint replacements are still done in open surgery.
Can I go back to that? How can you fix something with a little small opening, a little suture, whatever you want to call it? I don't know the word for it. But I mean, how does that work? Is it done with X-rays or?
Rarely an arthroscopic procedure requires X-ray guidance as well, but most of the time it's just a matter of using a microscope to look inside the joint. Tremendous instrumentation. So what I do is tremendously mechanical. So we have lots of different toys to work inside the joint, and mostly anything we can do open, we can do arthroscopically, and in fact, in my opinion, we can do it better microscopically than we can do with an open and just visible with your eyes.
But then you have to be in good shape. It's a physical, it's not just medical, it's physical.
It can be physical. You stand up, 8 or 10 hours a day in surgery.
MRI versus X-ray.
MRI is a huge advance. X-rays still have a place because it's a relatively simple, straightforward, inexpensive way to glean lots of information about bones and joints and some soft tissues. X-rays has a little bit of risk, but when you have a jet trip across the country, a plane ride, you get the equivalent of one chest X-ray. So we are bombarded with X-rays, so it's not a very big risk with some. MRIs have no X-rays. They use magnetic field and radio waves to excite particles in your body, which then create an image on the computer so that we can see inside of the body, including muscles and tendons and nerves and vessels and bones, and it just adds to the amount of information.
If you had to pick one thing that's really made your job easier or is really a wonderful new procedure, is there one that sticks out as far as treating athletic injuries or work-related injuries over the years?
As far as new, I don't know that there's been anything that has changed my life dramatically, but arthroscopy is certainly the one that drew me to my specialty, and it continues to be advanced, and we do more and more with arthroscopy and less with open procedures.
Okay, well, I've got one last thing. I was watching Plant play Manatee. Did you watch that game a couple weeks ago?
I didn't see all of it, but I saw some of it.
It seemed, I mean, I played high school football, but the speed today of the athletes today, let's just take even the pro sports. Are we going to reach a point where the body, the bone structure, can't handle the contact because they're so much better? In the old days, you had a lineman, if you weighed 300 pounds, he did the 100 in about a minute and a half. Now they're doing it in 12 seconds, 10 seconds. Is the body going to be able to withstand some of that punishment with the speed that they play at today?
There is a risk of that because when you get bigger, faster bodies crashing into one another in a truly collision sport, there is some of that. And equipment sometimes is actually good and sometimes bad. In my opinion, for example, we should get rid of helmets because helmets create the situation where you are allowed to run into somebody full speed and creates injuries, both in the recipient and on the hitter. So on both sides it causes injuries. So those sorts of things are bad. But yeah, indeed we can have an injury rate that's going up despite being well conditioned. If you're going faster, you're bigger, and you're stronger, the amount of force that's created is tremendous, and it's bigger and bigger all the time.
Well, I've enjoyed this. As always, you're a wonderful person to speak with. You've got such knowledge and a wonderful staff. And if there's one last question that you'd like to ask, just speak it out.
Oh, seminars. If people want to find out more about different procedures or have questions, where can they see you?
We'll talk about it, but I wanted to tell you that Lisa has done a lot of work. Lisa Lafley has done a wonderful job putting this thing together, and she deserves a hand. You did a wonderful, wonderful job. Your sincerity and professionalism was very good. I've been doing this for a long time. You did a very good job. So we'll close on the seminars.
I've known Lisa Lafley for a long time. She's a tremendous person. I love her to death. And that's part of the total package that we have here. Lisa's one of the people that helped to assure an excellent experience coming to the Advanced Sports Medicine Center. Part of that is we like to allow people to learn about us and learn about their orthopedic problems. As such, we work with Stryker Corporation and we give lectures and open discussions about arthroplasty, which is joint replacement regarding knees and shoulders, hips, things like that. So those are given around the city frequently. In this venue, in the building itself, we also have open seminars regarding arthroscopy, rotator cuff repairs, ligament reconstructions, meniscal problems, tennis elbow, ankle injuries, shoulder separations.
How does the public know when these seminars are available?
Some of them will be listed in the newspaper. Some will be on the sign out front. We'll have placards as people drive by on 41. We're right across from the Cabana Inn, so after people come for their treatments and they get better, they can walk across to the Cabana Inn and have a drink and dance a little bit. As long as their knee's doing great. So we do seminars here as well to teach people what's going on, and certainly people can call any time to our office.
Give them a schedule of seminars.
Right.
I'll tell you what, on this show, if we can, what I'd like to do is get with Lisa, and maybe if you've got, as you have seminars coming up, we can put a graphic on the screen and might just help it out a little bit more.
They'll be listed on the website as well, so people can look there anytime they wish.
Do it. Doctor, it's always a pleasure. You did a wonderful job at the building and a wonderful job with your staff, and I'm very proud of you.
Terrific. Thank you very much. My pleasure.